My name is Shelley Chapman. I am a nurse practitioner at Children's Wisconsin in the kidney transplant program, and I am so honored to be here today to talk to you all about transplant evaluations. And I am hoping that by the end of my talk today, you will know a little bit more what to expect when your child is coming in for a transplant evaluation. So what is a transplant evaluation? You've probably heard the words and you're wondering, what does that all entail? And so today I'm just hoping to give you a little bit more insight into what that really means. So if you want to think about it globally, I think of it as a really comprehensive assessment to really see, is your child a suitable candidate for a transplant? And the goal is really to achieve a successful outcome for the transplant. It'll include medical tests, a review of the history, the medical history of your child, the surgical history of your child, as well as your family history. One or more providers will do a physical exam of your child. There'll be a social worker and maybe a psychologist who will do a psychosocial exam for your child. And there will just be a lot of transplant education that goes into the transplant evaluation. And this will include education about the wait list, as well as post-transplant management. And really, this transplant evaluation is done to ensure that your child is safe to undergo transplantation and that your family can really manage the care that is needed post-operatively. And really, this is all done to ensure that transplant is not only safe for your child, but that it is really the best treatment for your child. And so today we're going to talk about the transplantation evaluation. And while it may not be all the same, depending on the center you go to or the organ transplant that your child needs, I'm going to really try and talk about the similarities that you may see no matter what transplant center your child is going to be evaluated at. There certainly may be some specific details that your transplant center will have that might be a little bit different than what we're going to talk about today, but my goal really today is to talk about the similarities that you may see no matter what center you go to and no matter what organ transplant your child does need. Your child will need a referral to a transplant center. And that referral can come from multiple providers. Your provider may be your primary care provider that may make that referral. It may be your local specialist, or depending on your situation, if your child happens to be in the ICU with an acute situation happening, it could be from that ICU physician that's caring for your child. So once that referral is made to the transplant team, they will contact the transplant team to let them know that the evaluation needs to take place. The transplant team will then alert your insurance company that this transplant evaluation needs to happen and the approval will need to occur for the evaluation to begin. The insurance company will let us know when the evaluation is approved and the authorization is made that we can begin the transplant evaluation process. Sometimes this evaluation may need to take place at a transplant center that you may not be affiliated with. Sometimes that means it needs to happen at a transplant center that is out of state. It may be a new team that you are not yet being cared for. But once that insurance approval is made, that information will be given to you so that you know whether or not you will be able to have your evaluation with the team that you already know, or if you will be introduced to a new team and where that team will take place. Sometimes, depending on your child's situation, whether or not this is urgent or if it can be done as an outpatient, the transplant evaluation may be done inpatient, or at times, some things can be done through video visits. It really will depend on your child's situation and how urgent this evaluation needs to take place. I put a map up for you on the screen to show you the 11 regions that our country is divided up into by the OPTN, which works through UNOS, to show you where all of the transplant centers in the country are affiliated. Each transplant center belongs to one region throughout the country. With UNOS, we have the United Network of Organ Sharing, which oversees all of the wait list throughout the country. They will regulate all of the procurements and transplantations that are happening throughout the country. They manage all of the policies related to transplantation and maintain all of the data that is related to any transplants that are done throughout the country. So, for example, I am at Children's Wisconsin, and we belong to Region 7. And so all of our waitlist information, our data that we collect for all of our transplantations belong to Region 7, and I will go to meetings related to Region 7, as well as I can attend national meetings. So just a little background for you on that. But like I said, once your referral is made, then you will be able to know where your child can have their evaluation, and then you will be able to go to the center that the authorization is able to take place. So the first step, once the authorization is made and you're able to get an appointment for that evaluation, again, whether or not it's done inpatient or outpatient, it will be organized for you by the team, and then you will need to have a consent to evaluate done. So one member of the transplant team will have to obtain a consent from you as the parent or guardian of the child to proceed with the evaluation. So this consent will need to happen before the evaluation begins. And this consent not only talks about the evaluation process, but it really goes into great detail about the transplant process itself. And it entails the risks and benefits of transplant, but there are a lot of key components to this process that you do need to know and understand as you get started. This will also include alternative treatments to transplant and your rights and responsibility as a patient and family for how you will manage the transplant. It will also talk about your rights as a patient and family to withdraw from the transplant process at any time. And if you felt that transplant was just not the treatment that you felt that it was, or if you just felt like it was not the right treatment for your child, you have that right to withdraw from this process at any time. And all of those things will be laid out to you during that consent process. The other things that this will include are the complications that can occur, the risks involved with transplantation, the long-term, short-term benefits and risks involved with the medications, the things involved with surgery, as well as things involved with accepting a donor a donor organ, as well as the things that you can expect when the surgery team is evaluating the organ that they may accept for your child, the risks that are involved with that. Those are all things that the team wants to be transparent with you and your family about. And so these are things that they are going to explain to you during that evaluation process, and are going to talk to you right at the beginning of that consent process, so that you are well aware of what you and your family are going to be learning about during this process, and so that you understand fully what you and your child are going to be undertaking as you agree to begin this evaluation process for transplantation. So the transplant team is a multidisciplinary team that you will be meeting during this evaluation process. There are a lot of people that you will meet during the evaluation. I'm going to begin with the transplant coordinator, who I like to refer to as your quarterback and your go-to person, the person that is going to get you through this whole process. The coordinator is the person who really is going to see you through this process from beginning to end, and the person you go to for any questions related to transplantation. If they don't know the answer to your question, they're going to find it. And this is your person that you go to with anything, any questions you have related to this process. They're going to be the person who is making sure that the team is staying on track, and they're also the person who um, has the has you as the main point in mind when they're trying to get you to the goal, which is the transplantation. And they're going to continue to keep you on track to make sure you're checking off all the boxes and getting to that goal of getting to that successful transplant. So the coordinator is that person that you want to make sure that you are in constant communication with if you have questions or you need to know where things are at in this whole process. The transplant surgeon is the person who's going to be putting that organ into your child. And you are going to meet with a surgeon to learn more about the surgery. You may not meet with the surgeon who might end up doing the actual surgery on your child, but you're going to meet with someone who is part of that surgery team. They're going to talk to you not only about the surgery itself, but as well about surgical complications that could occur. And they want to have you understand that surgery so that you understand the process of the actual surgical operation and you understand what that surgery means for your child. A transplant physician or APP, advanced practice provider, such as myself, is a person who is taking care of the medical management of your child in that specific organ condition. So we are going to be talking to you during the evaluation about your child's history, as well as determining what tests your child may need for the evaluation itself. A social worker is also going to meet with your child and your family. This is someone who is going to specialize in learning more about your family and how you're coping with your situation, as well as how you feel like your child can manage with the regimen that's going to be put in front of them post-operatively. We want to ensure that you and your child are well supported to get through this process, not only the evaluation process, but long term. This is not an easy road for anyone or any family, and we want to make sure that you and your child are well supported throughout this entire journey. The social worker is also going to be someone who can help you identify resources you may need to support your child through school. They may also be able to give you some resources for finding a room, maybe at Ronald McDonald House, to stay close by to the hospital if you need to be near the hospital for a period of time post transplant. They are just a wealth of knowledge, and I know for myself, I could not do my job as good as I do it without my social worker because they are just a wealth of knowledge. Our dietitian on the team is someone who's going to meet with you to not only talk about your child's nutritional assessment today, but is also going to talk to you about what you can expect for your child in terms of their dietary needs post-transplant. A child definitely needs good nutrition in order to heal well post-transplant, and that dietitian is going to help you understand what your child's needs may be after the transplant. Your child may be on a dietary restriction right now in the pre-transplant phase, and the dietitian will help you to understand if those restrictions are still going to be needed post-transplant. The dietitian will also talk to you about things that may change in terms of your dietary needs after the transplant. If your child is someone who's formula fed, they may give you some insight into how those things may change after transplant. Depending on what medications your child may be on, the dietitian may give you some guidance about some needs that your child may have that'll be different depending on the medications that are going to be used after the transplant. The pharmacist, just a person we couldn't be without after a transplant. Your child is going to need medications after the transplant, and the pharmacist is our person who is going to help you understand what those medications are going to be afterwards. They're going to review with you not only what the medications are, but also what the side effects may be, what complications can sometimes arise from those medications, and how important it is to not only take the medications every day, but what to do if perhaps you miss a dose, or if your child maybe throws up after they have a dose of medications. You may hear from multiple people how important it is to take those medications every single day, but our pharmacist is certainly the person who is going to have additional information about what to do if and when you may miss a dose, or if something happens and a dose is not given appropriately. The pharmacist is always a great resource for us too, when we have patients who maybe need to take something over the counter, or a patient gets put on an antibiotic, and we want to know if there's any interactions with any of our common medications that the children need post-transplant. So the pharmacist is someone who can look at your child's current medications, let you know if any of those are going to be continued after the transplant, as well as giving you that medication list for what you can expect your child to need after the transplant. A psychologist. Not all teams will have you meet with a child psychologist for the transplant evaluation. But if you do, they may work with your social worker to not only do a psychosocial evaluation, but they may do a little bit more in-depth evaluation of your child's cognitive abilities, or maybe some additional testing on whether or not your child may need some additional psychological support. And some of these testings may come out of the evaluation that the social worker does, or depending on your center, you may have a separate meeting with the psychologist. It just will depend on what the evaluation entails at your center. I included the infectious disease team in the evaluation here because at my center, we are fortunate enough that we do have infectious disease specialists that will see all of our patients in the pre-transplant evaluation. And that is a new team member that joined us a little bit more recently in the last couple of years, but it is just an incredible amount of knowledge that has just added so much to our transplant evaluation. And so with the infectious disease specialists, they really are focused on the infection risk for the patients pre-transplant, depending on where your child lives, or what risks they may have from their medical history. If there's someone who has a lot of respiratory illnesses, or maybe they've had a lot of urinary tract infections in the past, they will give you some insight as to how those risks may affect your child post-transplant. They're also going to review your child's vaccination records so that they can give you that insight as to what vaccines are needed to get your child up to date to go forward with the transplant, and then also talk about what prophylactic or preventative medications will be needed for your child based on these infection risks at the time of the transplant. So again, just an incredible amount of knowledge that they bring to the evaluation in helping us to determine some specific risks that your child may have for infection post-transplant. And then lastly, I included a financial counselor. And again, at not every center, you may not have a personal interaction with a financial counselor, but teams will have abilities to have a financial counselor available to families if you would like to have a little bit more in-depth conversation about your insurance coverage, coordination of benefits, or what other resources may be available if you do have questions about your insurance coverage for the transplant, and what out-of-pocket expense you may be looking at with what your insurance may not be covering. And so again, very large team, a lot of people to meet with during the evaluation, but all of the team members are so important to the care of your child going into the transplant. And then moving on to the testing for the evaluation. So a lot of blood tests, a lot of tubes. I like to warn families beforehand about how many tubes that they can expect for the child, because it is a lot. And so I just want to begin with the HLA typing, human leukocyte antigen typing. And so you may have heard of this test before. It's not used with all of the organs, but kidney in particular, we do use it to look for matching, and as well as some of the other organs may use it in looking to consider with the risk of rejection. And so it is something that all organs use in some shape or form, but in kidney in particular, we're using it when we're listing a patient. Blood type. We want to ensure that our blood types are known and confirmed. So all patients will have to have at least 2 blood types done prior to being listed for transplant. And so if your child has not had a blood type done in the past, they will need at least 2 blood types done prior to being listed for transplant. And then there are many different viral tests done prior to the transplant to look for exposure to different viruses, as well as looking to see how we may need to treat or use preventative medications at the time of the transplant. So things like HIV, hepatitis B and C, as well as CMV, EBV are all things that we're looking at because we want to see if the child's ever been exposed to these things, because we're also looking at these things in potential donors, and it may change the treatment that we use in the patient following the transplant. And then there'll be additional testing that we're looking at to look at the health of the other organ systems in the body, with kidney and liver testing, thyroid testing, some potential for some lipid panels or urine testing, as well as clotting tests, so that we know if the children are clotting regularly going into the transplant. And then lastly, I also included here panel reactive antibodies, which again is looking at circulating antibodies in the children that could make for more difficulty in potential matching of donors. In addition to those blood tests, there may be more imaging that is done. And again, this may be different depending on your child's transplant needs, specific disease conditions, as well as transplant center. But CT scans may be done to look at blood vessel patency. You may have some ultrasounds that might be done, as well as bone scans. But we also are looking at, the health of the other organs. Before we go in to replace one organ, we want to make sure that the other organ systems are healthy. And if they're not, what else we need to know about those organ systems before we go in for the transplant. So an EKG and an echocardiogram may be done to look at the heart, even if the patient is in need of a kidney transplant. Some x-rays may be done, some cancer screens may be done, as well as pulmonary tests. So very disease-specific testing may be done for the patient, depending on how ill they are, certainly, and depending on what condition got them to the end-stage organ failure that they are in. Some transplant centers may require a dental exam Some of this has been actually brought out due to some infections that have come up in the oral in the mouth, and then you don't want to go into transplant and then lower the immune system so much when a child may have an active infection going on. And so you may require your transplant recipients to go have a dental exam and have their teeth examined, make sure they don't need any dental work done prior to the transplant. And again, this may depend on how urgent the transplant is, but it may be part of the evaluation process for some patients. And I do want to just mention vaccines too, that depending on the situation, vaccines may be required to be up to date prior to going into transplant. So now you've had the evaluation, you have met with all of the team members, your child's had all the blood tubes you could ever imagine, and they've had all the testing you could ever imagine. What is next? We, at our center, we call it a committee review, a meeting that is done, and different centers may call it different things, but all in all, it's a meeting where the entire transplant team comes together and we review the patient's condition, we review the patient's labs, and we review the patient's imaging, and we decide, is this patient a transplant candidate? And if they are, can they then be listed for the transplant? So if that decision is a yes, we need to then figure out what listing status will they have. With some of the organs, that may be as simple as inactive versus active, such as with kidney. With other organs, it is going to be based on urgency, and the status will be based on how ill the child is and how urgent this organ is needed. In order to be granted that urgent listing status, the child will need to meet certain criteria that is laid out by UNOS. And so the team will need to ensure that the child meets that urgent criteria prior to placing them on the list with that status. If the child is someone who can have a living donor, that also needs to be discussed. And so during the evaluation process, that also is something that will be talked about. And if the family felt strongly that they would like to pursue living donation rather than having their child placed on the waiting list, that should also be something that is discussed during the committee review. Because if you have living donors that you would like to have worked up for your child, that is something that the team needs to also have in consideration and during that discussion in the review. All of these things need to be talked about when the child is being reviewed by the transplant team. So if the child is not deemed a candidate for transplantation, or the child is said that they cannot be active on the list, the team needs to determine what other recommendations there are for the patient. If the if the patient is deemed not a candidate, the reasons for this need to be spelled out. Every transplant center has selection criteria, meaning what are the criteria that make a patient eligible, and also what are contraindications to transplant, or what would make a patient ineligible for a transplant. And so when the patient is being reviewed as a potential candidate for transplant, these criteria are looked at as reasons for a patient to not be deemed a candidate for transplant. Perhaps a patient is too ill for transplant, and they are then deemed to not be a transplant candidate. This needs to be reviewed and determined and documented for why the patient is not a transplant candidate. If the patient perhaps needs further evaluation, something came up during the evaluation that was not known and needs to be further reviewed. The patient then may be not deemed a candidate currently, but perhaps may be a candidate after further evaluation. That also is something that would need to be documented and explained to the family. For example, maybe the patient is being evaluated for a kidney transplant, but during their evaluation, it was found that their heart tests were abnormal, and you want to send them to the cardiology team to be evaluated and determined if their heart is safe to undergo the kidney transplant. Once they are cleared by the heart team, they may then be deemed a candidate for the kidney transplant. Other things that could come up to make a patient not ready for active status could be concerns about adherence to medications. If it is determined that a patient there are concerns about their ability or willingness to follow the transplant medication regimen afterwards. This is very concerning because a transplant will not be able to be successful if the medications are not given appropriately. And if there is a lot of concern from the team that the patient is not going to take their medications afterwards, this could be a reason that the patient is not deemed a candidate. Or perhaps the team may say the patient needs to show good adherence for a time frame before they will be deemed a candidate for transplant. And the patient can meet with the team and show that good adherence for a period of time and then be brought back to the committee after a good period of adherence and then deemed a candidate afterwards. So whatever recommendations are determined by the committee review will then be needed to be shared with the family and then determined about whether or not the patient is put on the list at that time, if further recommendations are needed, or if the patient is not going to be a candidate for transplant, depending on what the evaluation showed and the discussion that took place afterwards. But no matter what, the committee review decision needs to be shared with you and your child, and will also be shared with your primary care provider, your primary team, as well as your dialysis unit if your child is on dialysis. So following the committee review, if you did have concerns about the evaluation determination or the decision that was made, always talk to the transplant coordinator and your primary doctor. If you need clarifications about what the decision was or the recommendations that were made, or you don't understand the decision that was made, please ask questions. There's always someone on the team that is willing and wanting to explain the decisions to you. So please ask why the decision was made the way it was. If you felt that you wanted to get a second opinion, this is always something you can do for your child. And then there's also an opportunity for your child to be listed at more than one transplant center. This should also be explained to you during the evaluation process. So if you thought that this was something you wanted to do for your child, the transplant team should be able to give you that information. This information is also available on the UNOS website. And lastly, I just wanted to also reiterate that UNOS does have a patient concerns line, and this should also be given to you during the time of the evaluation. That if you ever felt like you needed to talk to someone else about any concerns you have following the evaluation, about the transplant center or the transplant process in general, UNOS does want to hear about that. And so this toll-free patient service line number should be given to you at the time of your evaluation. And I also did just want to share that with you today as well, so that you had that. But overall, the goal of the evaluation is to get your child to a successful transplant outcome, and we really are all working together to give your child the best quality of life that we can. Again, I hope you have a better insight as to what a transplant evaluation all entails, and I am happy to answer any questions that you might have. Thank you so much.